You're listening to the Smith House Adventure Show. Hello, welcome to the show. Today's guest is Dr. Heather van der Geest. She holds a Bachelor of Science degree in psychology from the University of Victoria and a doctorate in naturopathic medicine from the Boucher Institute of Naturopathic Medicine. She has a focus in pain and injury management, regenerative injection therapies, and aesthetic medicine. She's a former member of the Canadian Junior National Rowing Team and captain of the UVic Women's Rowing Team. Thank you and welcome to the show.
Thanks for having me.
What got your passion started in rowing, and when did you first kind of feel, okay, I've been doing that as a hobby, now this is something that's really my thing?
Right. So I actually started rowing back in 2000. I was just about to start high school, and I found out that they had a high school rowing team. And so the summer before grade 8, I took a Learn to Row, and that 5-day Learn to Row program that I did, I absolutely fell in love with it. And I was like, this is my sport. And always as a kid, my mom was like, find a sport that you love, and that you can do until you're 100. And so when I found rowing, I absolutely fell in love with it. I ended up joining the high school rowing team, which rowed through the fall. And then I ended up joining a club team. And then I rowed from January till July or August before school started up again in September again. And I started rowing for the school again. So I did that from grade 8 to 10. I was, on a club team. And then in grade 11, I ended up making the international travel team through another club in Victoria, British Columbia. And we ended up competing at the Junior World Championships in Athens, Greece. So I did that my summer of going into grade 12. And then I continued to train with the international travel team through high school or through grade 12. And then unfortunately, we didn't make the Worlds again for 2004, I guess. 2003 is when I went to Worlds. And then 2004, we trained. There wasn't a female team in 2004, but we trained, we did international competitions. We rowed all over like the US and Canada and did a bunch of different competitions through that. So I raced in the junior women's quad in Athens, Greece. And we did very well there. And then I just continued to row. And then I ended up rowing for the University of Victoria for my 5 years there. And I was the captain of the women's rowing team for all 5 years as well.
Wow, that's amazing. What was it that you almost felt that right away? Like, what, as opposed to other sports that you might have been introduced to and stuff, what was it that you're like, I'm not doing any of those. This is the passion.
This is my sport. You know what? As soon as I got in a boat, I've always loved the water. I competitively swam, including while I was rowing. I used swimming as like a form of cross training anytime I got injured and every time in between. But rowing, it was just getting on that water, getting your blades into the water and just pushing, right? It's a whole body workout, like from your legs to your arms to your core. And I loved just that. It wasn't very peaceful rowing because you're rowing as hard as you possibly can. But there's that aspect of like individual trying to be the best you can be, but also having to work so cohesively as a team. Everybody has to be moving in the exact same movement at the same time in order to propel the boat fastest down the course. So I ended up doing very well, even in like early rowing days and, rowing up with different groups of like the older, I call them the older girls, but like I was a junior, they were a senior. And I loved it. And there was actually one regatta. It's called a head race. So you start one at a time and it's almost like a time trial. And this race was you row all the way to the start line, all the way up Shawnigan Lake. So it's about 7 or 8 kilometer race, but you row up that 7 or 8 kilometers and then you race back. And I did that. I actually rode, there's like 2 starts. There's a morning start and an afternoon start. And I ended up racing both. I raced one with my team and one with the senior team. By the end of that regatta, my hands were toast. They were ripped to shreds. Like I couldn't even close my hands at that time. And I remember, my parents were so supportive of me rowing and were at every regatta that they could be at. And I remember just holding my hands like this on the way home. And my mom drove me home and she goes, Heather, she goes, we can find you another sport. Like, oh my gosh, your hands. And I looked her dead in the face and I said, oh no, Mom, I love this. And through like blisters and what we call rail bites, where like the backs of your legs get all eaten up. And even through injuries, I just kept that passion for rowing. And I raced from, 1999, 2000, all the way up till 2010 when I graduated at UVic.
So did you always keep swimming more just became kind of like your CrossFit thing? Were you still competing in that, or it was just the rowing that was getting your competitive train of thought, so to say? Like it was just rowing as the competition?
Yeah. So I'm very competitive, and that's kind of come out through like my entire life. I always raced for high school for rowing, for swimming. And so I continued to do that through like the school season for swimming. But I did race a little bit for club teams in elementary school for swimming, and then rowing kind of took my entire life up, starting in grade 8.
Wow, that's amazing. And to find like that sport passion, that it just becomes your everything. And early on, you got ripped apart doing it, and it didn't hold you back. It was like, no, okay, this is the physical requirements. This is the sacrifice and the physical wounds I have to hold in order to become an expert at this. And I love talking to people like you and some of the special forces guys and everyone, just because it doesn't matter what obstacle was in their way. It's okay, I'm going to figure out around this. Okay, I didn't know how to wrap my hands, or I was holding it wrong. This now, this does everything. Like, it's just, I love hearing when people go, especially early on, where they get that wake up with it and go, oh no, there's going to be sacrifices with this.
Yeah. Yeah.
But
it's like no pain, no gain.
You further. Yeah. And it's
totally,
it's what I love with this show, and finding people that like you can just inspire people with the fact that like you have to put that in, but when you put it in, look what kind of passion that you can generate from it.
Absolutely. And I feel like I've done that in many different aspects of my life, with rowing, everything. It consumed my entire life. I pretty much, went from my grade 12 graduation to, actually I had speed orders the day before my grade 12 graduation. And so it was the day after. So I went to my grade 12 grad. I still had my hair in the full updo, and I went and I raced speed orders. I left my grad early. I was like, nope, I'm going to leave at 9 o'clock because I need a good sleep before speed orders. And, I just kept my hair up because it was out of my face anyway. And I was more excited to be at speed orders than my grade 12 grad. But, every kind of aspect of my life, I've kind of put that energy into something that I love. And, that's one of the things, we haven't talked about it yet, but I also have type 1 diabetes. And to be honest, I don't think I'd be where I am in my career or with rowing if I wasn't diagnosed with diabetes when I was 8 years old. And so from the time I was 8, I have really put everything I can into taking care of my health, for just making sure that I had no diabetes complications so that I could do anything I wanted to do. And so it kind of starts back at age 8 when I was diagnosed. And then I've just kind of carried that through rowing and like my career with rowing. And now, with naturopathic medicine and also helping other people with their health issues and, pain management. Absolutely. I mean, it helps me with my own health and injuries, but it also helps with, helping other people get to where they need to be.
Just for those people who you hear diabetes, but people don't have a clue about it, can you just give a brief little overview of that and then the type of diabetes that you have?
I have. Yeah. So There's three types of diabetes. There's type 1. That's the type I have. Type 1 is my body does not produce insulin. So my insulin cells from my own body no longer produce insulin. So I'm actually on an insulin infusion pump, and I test my blood sugars, and I have a continuous glucose monitor and an insulin pump. And so, yeah, my body does not produce insulin. It's usually kind of diagnosed in earlier childhood, although there are some people that get it a little bit later on. Then there's type 2 diabetes. Type 2 diabetes is more lifestyle related. You usually see it in like older, like more elderly population. But what that is it's almost the exact opposite of type 1. So their body is producing insulin and actually having to overproduce insulin, but their body's not able to use that insulin effectively. And so the body keeps producing more, being like, if we produce more, some of it has to get into the cell. So I kind of explain it like type diabetes is like there's a lock and a key. So I don't have the key to open the lock. That's type 1. And then for type 2 is they have a bunch of keys, but their locks are a little bit rusty or, finicky, and it's not actually able to open up the cell. And then the third type is called gestational diabetes. That's usually in women during pregnancy, where their body's just not producing enough insulin to take care of mom and baby at the same time. And that usually resolves after the baby's born. Sometimes, later on, they get type 2 diabetes or, years later as their kids are older. But it's just their body wasn't producing enough for having 2 humans to take care of.
Okay, thank you. For rowing, who became your biggest mentor?
Yeah, well, I mean, back in the day, there was Silken Lawman rowing in the Olympics in her single. There was Derek Porter, who, in my very first year of rowing, I got to meet him at an indoor rowing race. He was really good friends with one of my coaches. And so those were kind of like my 2 idols. But I mean, of course, there was also the women's 8 with like Marnie McBean and Larissa Biesenthal. And a bunch of my coaches were like previous Olympic athletes and raced on the national team. And it's, so I had a lot of mentors and like people that I really looked up to that were, dedicating their life to rowing as well. And I really thought, I was like, I'm never going to stop rowing. Like, this is going to be my life forever. But after I finished university, I kind of had to make that, there was that fork in that road of either move to London, Ontario, where the women's national team was training, or to, continue to further my education because I knew I wanted to go to med school. So that's where that path diverted.
Was that a hard path to break? Like rowing was your passion from so young and it was just everything. Yeah. And then med school, like, was it like a real toss up, or was getting into the medical field just that much more important to you that rowing then became less of a passion? And now it's just like a dear place in your heart, but you'll never probably train to that crazy level again, just because now you have to put that same dedication into your medical training, keeping up to date on everything. Was that an easy transition?
I still absolutely love rowing. I think what made that transition easier is I was injured at the time. And so it was one of these things. I wasn't rowing like as much as, I had a broken leg. And so I had also just graduated to university. So it was kind of this thing of like, this was my sign to just, go back to school. And but since the time I was 4 or 5, I knew I wanted to be a doctor. And that never changed, right? So I knew that's where I was going. And that was kind of like, okay, I've done what I can with rowing, and then so I decided to kind of split from that path and, finish my med school prereqs. I had graduated university, and then it was on to my next adventure.
So pre-university, what moment taught you most about yourself? Probably within like even rowing, or what was that one kind of that early defining moment that you still look back on when times are hard and you're like, no, back then I went through this?
Yeah. you know what? I'd almost say getting diagnosed with diabetes. To be honest, I had a very positive attitude about it. Like, I was 8 years old. I've dealt with a lot of other kids with diabetes and adults that have got diagnosed that, have had a bit of a hard time with that diagnosis. For me, from day one, they thought I had a bladder infection because when you're getting diagnosed with diabetes, there's a lot of sugar in your bloodstream that's not getting into the cell because there's no insulin to bring it through. But, and I grew up, my grandpa was a pediatric urologist. And so when I told my mom that I had to, I was like, Mom, I just always have to go to the bathroom. She took me into the doctor to see if I had a bladder infection. And it wasn't a bladder infection, but there was a bunch of sugar in my urine, which is a key sign of diabetes. But that day that I was diagnosed on March 8th, 1995, I got home from school, I got home from my piano lesson, and my parents met me outside. Both were crying. And they were like, and my mom had kind of prepared me, like, Heather, you might have to go to the hospital. Like, you're getting some blood tests today. Got the blood tests, went on with my day. And then they told me I had to go to the hospital. And that was the only time I cried. And and the words out of my mouth were on that day as I was 8 was, I don't care if I have diabetes, I just don't want to go to the hospital. And my mom's like, well, this is where we can learn about it. So my mom and dad took me to the hospital. The neighbors looked after my younger sisters. And so we went to the hospital. I was actually, my blood sugars, I caught my diabetes very early. So my blood sugars, if anyone knows about diabetes, were only 13 when I was diagnosed. To this day, I've been higher than that, but they caught my diabetes super early. And so I technically I wasn't hospitalized for long. It was just to get me onto insulin, teach me how to test my blood sugars, get me on a meal plan, and then I was free. So, but the only thing that I didn't want to do was go to the hospital. But once I was there, of course, it was more of a shock for my parents, and I looked them both in the face, and they still, I can still remember this. And I put my hands up like this. I looked them both in the eyes, and I said, enough of the crying. If I have diabetes, I have it, and now we deal with it. And, so it was like, my parents were like, oh, yeah. And I said, this isn't your condition. This is mine, and I'm going to take care of it. And it was actually kind of ironic that same month was also Diabetes Awareness Month. And there was all these little coin boxes by all the tills at stores. And it says cure diabetes, or, donate to diabetes, cure diabetes. And you also cure kidney disease, heart failure, blindness, amputation, death, right? And being an 8-year-old, that was at eye level of every counter for me. Right. So I saw this, and I'd point at every single sign, and I'd look at my parents and I'd say, that's not going to be me. And I mean, And actually, so next year in March will be my 30th anniversary of having diabetes. And I still to this day have no complications. My blood sugars are in great control, and I'm doing really well. So it's kind of cool. So we're at 29 years at this point with diabetes and going strong.
That's absolutely amazing. How has treatment changed from when you first started to how you deal with it now?
Okay. So when I was first diagnosed, I was put on injections. And so you're taking a long and a short acting insulin. And I did that for the first 5 years. Then I was actually part of a study that was putting controlled diabetic kids on an insulin pump. So insulin pumps, when they first came out, were more used for uncontrolled diabetics that weren't able to get control of it. But then they started a trial with a bunch of controlled diabetics to see how much better the control could be with their diabetes with being on an insulin pump. So I went on a pump in 2000, and I'm still on one. So so I've gone from using injections, and it started with 2 injections a day, right? You take your long acting, your short acting. And then when I ate, I took short acting insulin. And then I quickly progressed because I was rowing. I didn't to take 2 big chunks of insulin that are going to last you the entire day, that's a lot of insulin to take at once. And so then I started taking smaller amounts when I was eating, so that I didn't have as much insulin just roaming in my system while I was also doing these workouts. And that's where the pump came in, is because it gives a small amount of insulin, like every 6 minutes, 10 minutes, 6 minutes, whatever your what's called basal rate is. And then just giving that small amount of insulin. So I was a lot more able to fine tune exactly what my blood sugars were doing. I wasn't kind of at the mercy of when insulin was acting and when I had to eat, right? There's a lot of people that know that diabetics, they have to eat at, 7 and 10 and 12 and 2 and 5 and 8, right? Now on a pump, if I'm not hungry, I don't have to eat. I know that my insulin is stabilized to keep my blood sugars level. And then when I do eat something, I just tell my pump to give me the insulin.
That's crazy, because I know everyone's grown up with somebody who has been. And yeah, their schedule, everything kind of changes or revolves when they need the meal, because, I jab myself then, it's going to kick in now. Yeah, it's amazing with technology that you can kind of microdose yourself throughout the day to kind of have your nice, an even amount that if something comes up, your body can kind of get ready for it, and you just go on your app and you change whatever you need to, but you're not. Yeah. Do you find that like your body doesn't get shocked, or doesn't, if situations out of your control change and all of a sudden you can't do what was your normal routine before?
Yep. Yeah. And I mean, there are day-to-day changes. Sometimes I'm just like, who knows, and you can do something the exact same way from one day to the next. And sometimes your blood sugars don't do the same thing. So it is a constant juggling act between food, diet, exercise, stress, hormones, time of the month, right? Like whether, as a teenager, even going through growth spurts would change the amount of insulin at one time or another. So, but, it's with being on a pump, it does help me to more fine tune that. But I mean, there are still days that blood sugars, you're low when you didn't expect it, or your blood sugars are higher than you expected. And you just, the biggest thing I tell people is like, don't freak out about it. Just deal with it and fix it and then keep going, right? I've never let diabetes control me. And I've just always said that I'm going to control it. And I've done a good job.
That's awesome. What was the most valuable bit of advice you ever got from a mentor?
Just keep going, that's actually a good question. I feel like I'm going to think of so many as this interview goes, but one of them was like to decide. The definition of decide is to just cut off all other options. If I'm going to go after something, I'm going to do it, and I'm going to make sure it happens. And, and don't get me wrong, there's speed bumps along the way, right? Like it's not always a straight path of, okay, I'm going to row and I'm going to go fast. There was ups and downs. There was injuries I had to deal with, even through medical school. Like, I actually had a really tough 6 months of medical school where my blood sugars did not cooperate. It felt like whatever I did, nothing was working. But I just kept, I dropped down a couple classes just to kind of make sure that my own health was taken care of, right? Because you can be a doctor, but I mean, if you're just a shell of not healthy, then it's impossible to take care of anybody else. So I ended up actually taking a lighter course load for a couple terms to actually get my own health back on track. And then I was able to then pick up those courses. And, I graduated 6 months later than expected, but I graduated with a class that was like right behind me. And, it actually probably just gave my body that break it needed to just kind of make sure that I stayed healthy, and I'm doing great. But yeah, there are always speed bumps along the way, and you got to roll with them, because injuries and health, they don't always stay on the same timeline that you expected.
Well, and that's it exactly. I mean, joined the military, got injured very early on, right after my infantry course, and then just countless injuries after that, and probably denying to myself, how bad some of these injuries were, and keep trying to push through and just enjoy the lifestyle. And then, going back to school, was doing that. And then 4 bulging discs in the neck made the right arm stop working properly, and still a little bit of numbness in the finger. So again, I had to do a temporary withdrawal and stuff like that. But instead of just whining, complaining, I thought, all right, well, the show is just going to happen now. So that's kind of pushing through and stuff. Took some of the skills I've already learned and just going to keep going, because you do hit those speed bumps. But am I going to wait for school to start, or just, hey, jump into this and find the passion of, trying to support veterans and first responders and, their loved ones?
That's incredible. And because you have that history with it too, right? It's pulling all of life's experience together, right? And I think that's how I got into, treating athletes and pain management. Like, I had my fair share of injuries in rowing and just in general, right? I herniated 2 discs in university. Like, I was 19. I wasn't even 19, and I herniated 2 discs, but I recovered them, and I was in a lot of different treatments, and I credit those other like health practitioners that helped me get back in a boat and on the water, and then continue to be able to row and do what I love to do. And now I do that for other people, which is, I like when it comes full circle.
Yeah. And I think those are the people that have the greatest passion in something, is where they have their foot that was in another world and they've switched and transitioned to another one, but the 2 worlds can very easily blend together. So you can do that now, where you understand those injuries, you understand the mindset of a person who is at that level of dedication to a club or their university team or anything else, where they're hurting. They're pushing through that because the mindset is of the team. And so you get to talk to them in that same thing and go, look, I was at this level. I know exactly what you're feeling. Your probably pain level is a little higher than you're telling me the truth. Yeah, I get that. So you say it's a 5, I'll believe you, but I'm going to treat
it like an 8.
Exactly. So, and I think that what helps bridge, the gap though too with the athletes, where they understand that, you're going to get them back into top shape, but it's not going to be in the 3 weeks like they think it is. The body, takes this long to heal, plus the rehab. And you have to, you can give them that honest truth of, your treatment plan is going to be 12 weeks. But if you do those 12 weeks properly, then you're not going to have a re-injury in 6 months because you rushed that. And now look at you. Now you've missed that team or that certain thing because the injury is that much worse, and now it requires surgery. So I think it helps to be able to bring that bond that they can trust you a little bit more, that no, you're giving them their realistic timeline that they should follow. And if they do.
And don't get me wrong, I definitely try and get those athletes, and even people that are just, I had a patient just today that running is her passion, right? But she's got an Achilles injury that is preventing her from running. And, she's not an Olympic athlete, but that is her like gate to de-stressing. And so I'm trying to get her back to doing that, in a reasonable time, but also as fast as we can. And those are the people that end up in my office, is needing to get better. And then we figure out how to do it. So, but I think it's also kind of helped being in the medical field now as a physician, that I've also been in the other seat. I've been on the other side of that medical room, being the patient. So I understand what patients are going through. Like, they might be scared, or they might be frustrated that their injury is taking them out, or, it does cause a lot of like mental, angst when you're not able to do what you used to do. Right. And, so I just try and really give patients a realistic expectation of what's going on, but also get them better so that they can do the things they want to do.
Well, that's amazing. So do you challenge yourself often with new situations, trying to be a jack of all trades, or do you find yourself going over the same thing over and over till you've mastered that one thing before you'll start moving on to something new?
Yeah. So I have my hand in a lot of different areas. I mean, as a naturopathic physician, our scope of practice is actually quite large. Sometimes it's even like the jack of all trades, the master of none. But I would actually kind of disagree with that. And I mean, yes, I have a lot of tools in my toolbox that I can use to help a patient, everything from like diet to using botanical medicine and herbs to using prescriptions when needed to, working on mental health. We're working on digestion. We're working on stress and sleep. But what I have, yes, I do those things when somebody comes into my office, I'm asking about those things, trying to treat the person as a whole. But my area of expertise and the area that I really focus on is in pain and injury management. And so we're dealing with all those things to make sure that those injuries are actually getting better. And I have done countless courses and put tons of time into learning that, like becoming the expert of pain management in my clinic so that I can treat those injuries. So I do a lot of regenerative injection therapies to actually try and stimulate the body into its own healing response. But again, we're working on those other things. If your diet is horrible or you're not absorbing the foods that you're eating, or there's a lot of inflammation, the body has to deal with those things first before it's actually going to heal that injury. And so it's all taken into account, but my area of focus is in pain and injury management.
What daily habits do you think have helped contribute to your success from even early adolescence? Have they changed, or has you always had the same kind of habit that you always use?
Well, I think it's just, I mean, part of it's going with the flow, but also like I've always had goals, and it's like, how do I get there? Right. It's like I have where I want to be, and then it's about taking those steps. And it's not what I've really learned, and I mean, humbled by many times over, it doesn't happen overnight, right? An injury or like a health condition or a chronic illness, it didn't happen overnight. It's not going to go away overnight. And that's the same way that I kind of like view life. It's like, okay, this is my goal. What are the steps I need to do to get there, right? I wanted to be a very well-known, like in my clinics and in my, like I practice in New West and I also practice in Chilliwack. And I just wanted to be like an expert in my field and be really good at what I did. And, through word of mouth and the courses I've taken, a lot of people know that in Chilliwack, if there's an injury, medical doctors refer to me. Orthopedic surgeons are starting to like learn who I am because I'm preventing or delaying their need for surgery. And we all have a place. Like I love working with GPs and family doctors, right, that are seeing those patients. And then when, they have their area of focus, I have my area of focus. And if we all pull this together with specialists, family doctors, me, we're coming to help that person in the middle from all of our different aspects and our different education and knowledge to be able to help that patient, right? So it's not just like one, like, if this doesn't work, there's nothing you can do. Or if you need surgery, that's all you can do. There's a lot. I prevent and delay the need for surgery on a daily basis. But also if somebody's had surgery, they're in my office helping to work on keeping that range of motion in their joints, like working on scar tissue, working on preventing that inflammation from stopping that surgery or injury from healing as well.
Do you find that you're somebody who makes multiple plans just in case something doesn't quite go how you thought? You have some contingencies that now you can start putting into practice. And if you do, was that something that maybe with your health that you became a person like that who had to devise many different scenarios just in case A didn't work? Oh, don't worry, there's B, C, D that you had to deal with? Yeah.
And I try not to make myself crazy by being like, okay, this didn't work, quickly. It's really about pivoting though. It's like, okay, you're going on this. Okay, you hit a bit of a roadblock, or it's like, which way do I have to kind of dodge to get around and keep on that path? I think it's really about, kind of keeping that end goal in mind and taking those steps to get there. And one of my favorite quotes is like, one step at a time, because, you can't run before you walk. And, but it's really about just kind of seeing what's there. And, if one plan isn't working, of course, kind of, be in a parallel way, but just kind of step over to another path and keep working on it. And then sometimes they actually like, cross again later on. So it's really, I mean, I always have my goals, and I just kind of, there's always a, like, if one thing's not working, there is another kind of plan A, B, C, D, E. But I'm not kind of like trying to do all those plans at once. It's like, I'll see what works. And then if I have to pivot, I do. And I've got a lot of mentors, and I love making those connections, because that kind of opens up, other doors for something I may not have thought of that helps me get to that goal as well. Or it's in a completely, it may have actually kind of put me on a different path that's got me actually to even, to where I actually want to be. I never thought I'd be in Chilliwack, like, of all places, right? But I had an opportunity there, and it has probably been the best decision to move out there. Like, I'm close to rivers and lakes and mountains, and I've got an amazing practice and such supportive colleagues. And it's, and I have a patient base that I absolutely love out there. So, if you had asked me while I was in med school, where are you going to practice? I'd be like, Vancouver, where else would I go? But I've ended up in Chilliwack, and I'm also practicing in New West. And it's great because I see a different group of patients, but it splits it's busy, but it gives me a lot of like variety, but also doing exactly what I love.
No, that's amazing. What are some of the short and long-term goals that you have for yourself, for a little bit of personal, like you said, you're out in Chilliwack and you have access to nature, and then professional, what are some of your goals? Like, with access to kind of the water around Chilliwack, would you want to not row like you did, but would that become maybe something that might get a little bit more that you can do, as opposed to if you were in a bigger city trying to get all that stuff out to some water?
Yeah. So, definitely Cultus Lake is like right around the corner. I still love being in the water. If I can swim, I'm swimming, I just bought a paddleboard and a kayak. And so I'm still getting my water, urge, and then getting to actually kind of work on that. It's funny. I always think about this. People are like, are you ever going to go like row for fun on a master's team? And I would love to, but I also know how competitive I am. And I'm not sure I'm at the point I can row for fun yet. And I would love to. And of course, if I got in a boat tomorrow, I'd be like, this is the best thing ever. But I love being around water. And so however I can do that, whether it's, being in a boat, whether it be in a kayak, on a paddleboard, or swimming, that's where I am. So I still get my water time.
Do you find that water is your ability to decompress? And if you don't have access to water, do you find a little bit of a stress kind of building because you haven't been able to get that soak on?
Yeah, well, and that's actually funny you bring that up, because when I finished rowing, I almost went into this like identity crisis. I didn't realize how much being on the water was like my mental, not break, because it was very physically demanding, but it just allowed me to like let go of any stress. If something happened on the water, it stayed on the water. If something happened on land, it stayed on land. And I could like shift between those two, right? Then when I finished rowing, I was like, what do I do with myself? I'd be like, I'll go for a run. And I'm like, oh, but it's not water. And so being by the water again, I grew up on the water. I grew up in Victoria. So I was always around water, but I do find myself, if I'm having a tough day, I'm usually at the lake or at the river, even just going for a walk and just being like, okay, I'm getting myself back on track. But, there's different ways to decompress, but I have my best days when I'm by the water.
Well, and for you, it's water. For other people, it's you getting into that flow state where nothing else is mattering but in that moment, and the worries and everything just go away. And even when not competing, you still had that water and stuff like that. And there was still, I think that's a problem with a lot of first responders and veterans, is that they had that rowing and the career that they had. But then as soon as that changes, it's like, well, in my previous guest, we talked about it too, but you lose that sense of identity. And for some people, they're able to quickly pick something back up. But for others, again, you put 20, 35 years, whatever some people go up to for some of the, the ones that really make it their career passion.
Yeah.
That was it. Like from 18 to 65, that's all they've ever known. And it's a real hard thing to break. And I liked how you kind of talked about that too, how there was that little bit of that identity loss where you had something that you used and it was your meditation moment. And even if it is a hard activity, it leveled everything out and you were able to have the two worlds and have that peace and quiet.
Yeah. It just being on the water and like sometimes you don't even have to say a thing and you just hear like the boat go clunk, and the waves are like the water as you're like pushing your blade through the water, and just the fact that you're physically exerting energy, right? I mean, going to the gym is great. That's a good stress release. Hanging out with friends, going for a walk, going for a hike, being by the water, even if it's just walking along the river. Like, yeah, those are kind of my ways to decompress and just some like quiet time to just sit. But physical exertion does help to kind of get all the the extra energy out of your system.
Well, and also how you were describing with the rowing, that 7K event, that one there that you did early on, like you're seeing nature and stuff like that too. And that's also an amazing thing to get yourself into. And I think that was also maybe a little bit, well, you talk about now, like being around the water. There's something about seeing nature around the water and getting those little moments that, that is just yours. Seeing that bird or the family or the beaver, whatever animal life is in that, you get that special little moment while you're putting yourself through, a horrendous time physically.
Yeah. Yeah. And also just that fresh air. Like, I mean, now that it's getting into spring and summer, getting out camping, it's just, it's such like a release. And I mean, that does tie into naturopathic medicine about, like grounding and just making sure that you're really centered and getting time outside, right? Like, we see a lot of low vitamin D levels, even through the summer, if people aren't getting out in that sunshine. And again, as a naturopathic physician, I'm trying to treat the whole person. So it's really about like their stress and how they're decompressing and how they deal with stress and what they do on their time off to recharge. And being outside in fresh air is a big one, right? It's getting movement. It's getting that blood flow into your system or through your system to just keep everything moving. It's that use it or lose it.
And I think that so when the injuries flare up, and just this last time there too, I hated not getting out. Like, get up at 4 a.m. to get on that road to get to BCIT, because that traffic gets pretty stupid early on. And then gym opens at 6. So it'd be, doing a little walk around campus for like an hour, hit the treadmill, and then it was walking around all the time between classes or doing like that. Like I loved walking around, and then early in the mornings when it's still quiet in the city, walking around the city and checking it out, and just you get to explore that. And what I hated this last time with the injury was the fact that I couldn't get out there, and I wanted to hike and walk like Teapot Hill and Chilliwack and stuff like that, and doing those fun little things. Like military, you hate doing a ruck march, but I kind of didn't mind it either, because even now, like it's something I love to do, because you get those little snapshots of nature that are just yours. And it's cool watching and seeing just that interaction again with nature. And I think if more people kind of got out to nature without the cell phone and just go for a little walk around a simple lake, it doesn't have to be challenging, but there's that little connection that you get with it that I just feel recharges a battery that we don't do often enough. Yeah.
You got to recharge, you got to unplug, and, because it's so easy for us to get lost in our phones, right? We can always, no matter where we are in the world, somebody can get a hold of us with our phone. And, being out in nature, it's good to just, I'm almost I went camping a couple weeks ago, and as much as I was like, oh, there's no reception, I was also like, cool, there's no reception. Like, even if I wanted to answer this call, I can't. And I can actually just appreciate. And that was the time that the northern lights were in the sky. And I was like, this is pretty great. So I got to forced unplug, with no service. But it just, you spend quality time with friends, you're out in fresh air, your sleep in your circadian rhythm just resets because, you're not on, lights in, it's not just lights in your house that are on. It's like, okay, the sun went down, it's bedtime.
Yeah, one of the greatest naps I ever had was out in the middle of a training area, having just a little bit, but being a driver for this one exercise because I had the qualification. So they're like, hey, guess what you're going to do? And just being so tired and be like, hey, you watch the vehicle. I'm just going to take a nap right here in this ditch.
Yeah.
And I just need to get this little bit of rust off just so I don't drive off, the middle of the road doing blackout driving at night and get in trouble. And that little bit when you're just like, wake up, Smith, wake up. And I'm like, oh, like feeling the grass, like it was the most recharging little bit. But yeah, there was just something about nature and just kind of accepting it or embracing it.
Yeah. Yeah. It's good. Get out in nature. That's for sure.
Now, you said early on that medicine was always something you had your eye on. Did you always have your eye on naturopathic, or were there other things? What drew you into this field of medicine?
Yeah. So I really thought I would end up in, Western medicine, allopathic medicine. But as I was studying for my MCAT, which is like the exams to get into medical school, I ended up talking with a colleague of mine who's also a naturopathic physician. And she was actually she was in school at the time. And we went for coffee one day, and I knew her through friends, like through my undergrad. And she was in naturopathic medicine. And she just started telling me about what she was learning in second year of med school. And she was, really just her passion for it also just kind of helped get me into like, this is exactly where I want to go. She was saying like, we're looking at trying to treat the whole person. And, just some of the things she had learned in class that day, she was just spouting facts. And I was like, this is how I want to practice medicine. It allowed me to really interact. My appointments with patients are, my first appointment is an hour long. And in this day and age, there's so many interactions that you don't have an hour to just sit one-on-one with somebody and really get to know them. And it's an incredible honor, right, to be able to sit with a patient for an hour and really get their entire health history as to like who they are, what they've been through, whether it be with a health condition, a chronic illness, a new illness, something that they're trying to prevent, or an injury. How did they get to where they are sitting in my office? And so, yeah, when my friend was telling me about naturopathic medicine, it was like a light switch. And I was like, this is how I want to practice. And, my grandpa, is a urologist, right? So I knew that I knew that allopathic medicine, that's what I grew up with, right? But I really wanted to take that approach of treating the whole person. And I do treat very medically, in some of the things that I do, especially with doing injections. But I just loved having this better understanding of who my patients were and how I could help them, and also teach them to help themselves as well. It wasn't just you have this illness, here's your treatment, but also just, my questions with patients, there's a lot of them that are I've never been asked that question before, or, I've never thought about my health in that way. So that's been a huge kind of honor for me to be able to be on people's health journey with that. But once I heard about naturopathic medicine, and I was like, this is what I want to do. And so then I kind of shifted from the MCAT and applied to naturopathic medical school, and I got in, and that's where I am.
So once you got that, what are some of the specializations that you're like, oh, I want to learn this and this and this? What did going to school open up for you that you didn't really, most people didn't even know about, just because medicine is such a specialized anyways. Like what, as you start going to school, where did you start kind of loving the different areas that you want to start branching out into?
Well, with naturopathic medicine, like I said earlier, it's like we're the jack of all trades, right? There's many different courses from like nutrition to counseling to botanical medicine. We learn homeopathy, we learn acupuncture, we learn adjustments like a chiropractor, we learn like the physiology and the anatomy and the physical medicine. So I got to experience all those different kinds of modalities that are in our scope of practice. And, I really thought when I first got out of school, I was like, oh, I'm going to do women's health. But that quickly, then when I loved like physical medicine and doing adjustments, and I practiced those a lot, even during my residency, I would go into like the adjustment lab at lunch, in between work shifts or classes. And I would just do adjustments on whatever students needed adjustments. And so I got my hands on so many people and I could feel different things that were going on, some similar, some different. And, I do a lot of adjustments in my practice, like a chiro. I work with a chiro, which is amazing. So sometimes they'll go see him and then they'll come see me for other treatment, but I can also adjust to just make sure that people are structurally aligned. But yeah, then as I did take some injection courses once I graduated. And then I was like, this is where I want to be. This is what I love. And the fact that since the time I was 8, I've had a needle in my hand with giving my own injections for diabetes. It sounds kind of funny, and I tell patients this too. It's like, I've had a needle in my hand since I was 8. I'm very comfortable with a needle. I have given myself thousands, of needles in my lifetime, and now I give them to other people. But I'm very comfortable with a needle. I understand my anatomy, and just with each course I've taken, I've probably medical school was expensive, but then, the amount of courses that I've taken after in this field of naturopathic medicine that I love it's so worth it. Like I took another class this past weekend, and it just adds to my, my repertoire of what I can offer patients and how I can help them. And again, naturopathic medicine is a very individualized form of medicine, right? It's not a cookie cutter. It's not like if you come in with a knee injury, this is how we treat. Everybody's different, right? I may be doing muscle injections for somebody with a knee injury. I may be adjusting somebody. I may be like trying to help their joint, or add some extra kind of cushioning in a joint, if they have arthritis, or I'm treating a ligament, and kind of strengthening up a ligament or tendon that's kind of been extra stretched like an elastic.
What is your favorite subject that you ever got to learn? Like something that maybe was unusual that you never thought it even existed? And what is a subject that you want it, but maybe, where you have to go, or it's not something easy that you can do? What would be the one subject that was your dream to learn, and the dream subject that you want to learn in the future?
Oh, I'm going after those dream subjects, and finding a place to do them. If I want to do another injection therapy, I found a way to do it, because it's helped, in Canada. I should say, my injection therapies for regenerative injections, whether it's using a solution or actually using the patient's own blood and their platelets to actually heal an injury, I'd say that's my favorite, And then I also do trigger point injections for helping release muscles and actually reset them and reprogram them so they're not just fired up and tight, protecting an injury, right? There's a lot of muscle involvement, even when, there's an injury in a neck or a back. Muscles tighten up to protect that delicate structure. And then they sometimes forget to relax even after, in order for that injury to heal. The one thing that I would love to do, but we can't in Canada yet, is using peptides, because I think they have an amazing, kind of use for kind of in helping with healing. And I would love to learn more about peptides, and I'm sure I'll go down to the States and even just take some courses in learning that. But in Canada at the moment, we can't use them, but doesn't mean I don't want to learn about them.
Can you get into what are peptides, just so that people can understand what that is?
Oh, good question. So peptides are proteins that are just helping to, and I may not have this definition fully correct, right? But some of the peptides that can be used just help in kind of reinforcing the body's own ability to heal, and it's just giving those extra proteins and nutrients to that area to help heal. I may actually have that wrong, but peptides are building blocks of proteins.
Okay.
So it goes the amino acids, build the peptides that make the proteins.
Okay, perfect. What was your biggest challenge in becoming a doctor? Did you find that because you wanted to do it from so young, did you make sure all your ducks were in a row, like early on, or was it like, I have no idea what it's like to kind of get into medicine.
Yeah.
What is it like for somebody trying to get into medicine?
Well, so I have an undergrad. So I did my undergrad at UVic. Then I took some extra prerequisites for like courses that are required for medical school. So I had to take a biochemistry course that I avoided like the plague in my undergrad, but had to circle around and take it to get into med school. Just making sure you have all the different science credits that are needed. And then, but yeah, medical school, it was challenging, right? There were amazing times, and I wouldn't change it, but there were multiple times that I was in the program and being like, and especially when I was sick and really having a lot of trouble with my blood sugars, I was like, I don't know if this is for me. I barely feel like I'm hanging on as a person and trying to manage my blood sugars. And then also just having, 10, 11 classes just fired at you. Medical school is like a fire hose. And it's just like, you're just standing there trying to catch all the water but it's being realistic with yourself you're learning a ton of information. It's not only presented once, you're presented with it over and over. And then one day it just kind of clicks. And, it's even if there were classes I struggled with at school, and I think everyone did, right? But then when you see them in practice, it's like, oh, all these lectures are just and it kind of just pieces together. And I was like, I know how to help this patient, right? And it doesn't happen overnight, but there were multiple times I would go into the dean and say, I'm not sure if this is for me. I'm so overwhelmed. I haven't slept. I'm exhausted. This class is, challenging me to my nth, degree. But then you'd get through it, you'd pass the course, and you'd be like, okay, it's a new term. Let's go again. The number of times I said, I was like, I'm not doing this anymore. I need a break, or I need a break. That's what I always said. And then I'd be like, okay, I'm not going to take a break this term. I'm just going to keep going. And then I just kept going. And then I finished.
And that's sometimes all it is just putting that next foot forward and be like, okay, just do that again. Do that again. Do that again. And you look back, you're like, oh, wow, I just traveled this distance. And I wasn't even paying attention so much to the external problems.
Yeah. Med school definitely, those 4.5 years of med school definitely felt a lot longer than the 6 years I've been out of school now.
What was that one course that you had trouble with? And then what was it that you found helped you get through that course?
Just putting the time into it. So, our courses were, there was something called biomed, which was all of the physiology and the biochemistry. And there were 6 of these classes. And I think each term there was a struggle of, we had this class 3 times a week, and we got tested twice a week on the material, and it could go back 6 lectures of what they could test us on. And I just felt like I was learning something, and then I'd finally understand it and it wouldn't be tested anymore and we'd be on to something else. But, I got through it, and it was definitely a struggle at times. And then I'd see classmates and they just understood it right off the bat. But I know myself, I'm a very kinesthetic learner, and it's I learn by doing. So as soon as I could see it in a patient case, and there was that relevance of how this biochemical pathway was that I was learning in a textbook, that I could put it into actually working with a patient, that's when it really clicked for me. So I felt like I really thrived in third and fourth year with like my residency and actually getting to see patients, because then you're looking at a patient case and you're going back to your textbooks to understand what's going on. And I felt like that's where all those puzzle pieces fit together for me.
Being a student or being a teacher teaching medicine, which one do you find more challenging?
I mean, being a student is, you're learning it, you're in it. As I said, it's like a fire hose of stuff, but I have gone back to actually teaching at the medical school, and it's good. It's really cool to kind of share my education and my own clinical experience in teaching this lecture material. I teach very much like how I wanted to learn too. So that material is, hey, I'm teaching this, but this is how it actually integrates into a patient. And so I gave a lot of patient examples. It's no doubt that I have a very like hands-on practice, because that's where I thrive. Like, yes, I can do the diet and the nutrition and the stress and the sleep, but when it comes to that injury and me, being able to like manipulate a joint or to help with a ligament or a tendon or a muscle, that's where I thrive. So my classes are very animated and very like hands-on, physical. Let's actually practice this. Let's do it. And then I give as many patient examples as I can so that there's a real world example. It's not just something you learn in a textbook and then, and you have to keep reviewing it, right? So I still review things. So, I do like teaching. It's kind of fun to be able to, share also with this like up and coming doctors that, when they graduate, they become your colleagues. And, it's nice to have, I think information is, what I've learned in practice, I want to share, right? Because that helps other people learn. And then they're learning from me, I'm learning from them in our different areas that we've, of like what we do in practice. And the best part about naturopathic medicine is that a patient could go see my colleague for the exact same injury they're seeing me, and we may treat it very differently and get to a result that patient is better, right? So there's not just one way of treating something. And I like that. And I don't think there's one way of teaching or presenting information. And I do what works for me, and that's going to work for students. And then other students are going to thrive in learning it from a textbook. I learn from doing.
Do you find that going back to teaching and going back to some more of the basic steps just reinforces and kind of reminds you of other things that might drive you to go into get another specialization?
Yeah. So what I was teaching wasn't really in my area of specialization. To be honest, it was going back to like some of those like basics and fundamentals of naturopathic medicine, which are always good to kind of remind yourself of, because in a practice that I do a lot of like medical procedures and injections, it's also important not to forget the roots of what naturopathic medicine is and where it came from, right? It's sometimes, the use of water. I taught a hydrotherapy course, and that's the use of water in helping healing, whether you're using hot water or cold water or running water or sitting in a tub to help with something, adding different herbs that help in healing as well. It's always good to go back to those roots. Like, I mean, we wouldn't have naturopathic medicine if it wasn't for like the people before us that really fought to have, the practice that we have, and for those people to advocate for us to have more rights in the medical field, right? We now have prescription rights. I do injection therapies wasn't really, if people think about it, is not the most naturopathic thing to do, but it's, I'm also going back to those core elements of naturopathic medicine in using a very like medical approach to naturopathic medicine. But I do treat differently than, if you see me, it's going to be a very different treatment than if you go see a colleague that maybe doesn't have their injection rights or certifications or even their prescription rights. They can still help so much in treating that person and getting to the root cause of what's going on. And then I deal with the injuries.
You said with having to take so many tests a week, how were you at test taking, and what kind of tricks did you have or and advice for students who are doing medical schooling?
Yeah. So, I mean, it's constant studying and reviewing. And like, for me, it's not like I just read something and it's in my head. I have to like understand it. It's like, I got to see it. I got to hear it. I got to do it. And then see it actually in practice multiple times in order to really kind of understand that. Test taking is, it's tough. And when I was in school, it wasn't just multiple choice. So our licensing exams are multiple choice, but we had short answer questions on all our exams. So it really made sure you understood that material, because you had a big blank space. There was no correct answer there. You had to fill it in. So it really helped to understand the topic, better. But then when it comes to licensing exams, there's 4 answers there. They're all technically correct, which is the most correct. I got through it. It had its moments though of just like, what, like, how do some things I just understood right away. And then other things it took, I took a couple times of seeing it, hearing it, doing it. And then I feel like it's clicked even more now finishing school. And I'm like, oh, actually, I remember that was a question on a test one time. I may have got it right then, but now I like understand it even better.
So what was your first real challenge as a doctor that you can think back, and that was something that it left a real mark on you?
Ooh, challenge. Well, I mean, when you first start out, nobody knows you. And so you have to make a name for yourself. And it was really, I mean, I put my head down and, I joined like a networking group so that I was like networking with other business professionals. But the thing about naturopathic medicine, there's a lot of people that don't really know what we do, or they've seen one naturopathic doctor, but it's not like that one, is what we all do, right? So I find I do a lot of even education with my patients in just better allowing them to understand themselves, and also what I can do to kind of help in the bigger picture. So, I mean, I think I did it pretty well. I mean, I have 2 very busy practices, but I've put a lot of time into networking and educating, right? And talking about what I do. And I mean, it's a passion of mine, so I like talking about it. And just educating people so that I can educate people till I'm blue in the face, right? But when it kind of resonates with them, and there are people that I've talked to 2 years ago that then show up in my office. They're like, I met you 2 years ago. I've thought about what you've said for the last 2 years, or you did a presentation and I was there. And yeah, I'm ready. And so I'm like, perfect, right? It's doing presentations, it's networking, it's getting yourself out there. It's, working with other doctors and kind of everybody sharing and helping each other. And then everyone kind of has their area that they just thrive in. And then we all work together to get patients in the door.
What kind of hours does the average doctor put in?
Oh, don't ask me that. I work a lot. So, I mean, there's a lot of my colleagues, work 3-4 days a week, and they've got a busy practice. I don't know how to rest at this point. I kind of laugh at myself because it's funny, but I have 2 full-time practices. So I'm working 3 days a week in Chilliwack and 3 days a week in New West. So for the last year and a half, I've been doing 6 days a week. But I love it. And I do, I will take the occasional weekend off, but I mean, this is not sustainable until I'm at retirement age. But I wanted to really jump in, get those practices started, get them rolling so that patients knew I was there. They knew what I could do, word of mouth, getting those referrals from either other colleagues or word of mouth by patients that have seen me or, seen like a YouTube, a video like this, or whether they've seen my Instagram or my Facebook. I do a lot of work on Instagram and Facebook to just, again, educate, right? It's not giving medical information there, but it's educating on what I can do, because it's not always known. Like, there's a lot of people that don't know that you can actually regenerate your body with your own cells, to kind of help prevent or delay that need for surgery, right? People know medications, they know steroids or cortisone, and they know surgery. But my entire practice sits in this: medication's not working, or you can't just live on pills, or you're in line for surgery, or you're not at that point where it's injured enough to be in surgery. And that's where my entire practice sits. So I do a lot of education with that. Yeah. What else was the question? Sorry. Oh, how much do I work? So yeah. So I would say 3 to 4 days, 5 days a week are a lot of those of my colleagues. I'm working 6 at the moment, with 2 full-time practices, but I love it. And but I do know when I need to take time off too. But it's been nice to kind of get these practices started and make that name for myself. I like people to know that I love what I do, and that they can count on me to kind of help, and I co-manage a lot of different cases with other naturopathic doctors, with other like medical doctors and physicians, and all working, again, as a team to kind of help give the best care to a patient.
What is the biggest challenge being a doctor that the general population doesn't quite know and understand, like with some of the stresses or whatever that it comes with, a variety of people that are in the medical field?
Yeah. You are hearing when for the most part, doctors are hearing when things aren't going well in somebody's life, right? So, but I find it a huge honor that people step into my office and trust me with their health in a way that, their family isn't, like, can't help them, right? They don't have that medical knowledge, or, even within 5 or 10 minutes of somebody being in my office, they're telling me very intimate personal details about their life or an injury or, their mental health that doesn't really get told to anybody else in their life. And I think it's a huge honor, but you do hear a lot of things, and it's really about being there and being present and helping them on their journey. And I think, my counseling classes at school, I think, come in more handy than I ever really thought, right? You do hear heavy stuff. You do see stuff. There are patients that don't get better. There are patients that, due to their illness or, pass away. And it's, there's a little piece of you that, gets lost with that too. But it's also about continuing to help those patients. And with doing what I do, emergencies happen. And so you gotta kind of be prepared for those too. And, if there, and it's kind of a joke, with some of my friends and stuff, of just like the emergencies that I see. You don't really think in naturopathic medicine that emergencies are going to walk through your office, but it's almost like the universe knows I can handle them. And whether they're outside my office and somebody has a cardiac arrest, I've dealt with that. I've had people, off the street say, like, I'm having an allergic reaction, and we deal with that. I've had people, faint in my office, and it has, it's happened before, and it will happen again, right? And I pride myself on being very good at handling those situations. Like, I don't go search for them, but when they do happen, I think I handle them well. I keep calm, but they do happen, But yeah, one of the things about a doctor is, like, you gotta learn to be able to separate life from work, because you can work all the time if you don't separate home from work. And sometimes work has to come home, and I need to work on something, or I need to call a patient on a Sunday that I have off to check on them, or somebody's in the hospital, or somebody has a reaction. You're on call, but then you also have to have that boundary of, you can't always be on call, and, family and friends also take that priority. But it's always, I work in a field that people, I don't deal a lot with cancer. I do have patients with cancer, and, and some, there's times that they get better and you're celebrating with them. And, even those minor, it hasn't progressed or something like that, and you're happy for them. And then there is also patients that, end up succumbing to their conditions, or even just, accidents and stuff. And it's, so much about that person, that everybody has a little piece within me, and each new patient, adds to that. But, I'm very fortunate. My goal is to help people get over their injuries and get back to the activities they love. But working as a whole with patients' health, you experience the good and the bad. And I truly value all of that. And you can't have the good without the bad, and you just got to take it in stride.
Favorite medical tool you use daily, and the favorite one you ever got to use? Maybe those rare ones that just...
Yeah. I think my favorite is still what I do every day, and that's a syringe and an injection in my hand. I'm known as the doctor that always has a smile on her face when there's a needle in my hand. And, some people are like, "Are you a psycho?" And then they laugh, I had a patient ask if I actually had friends, just based on how many injections I'd given to him. He's like, "Do you have friends?" And I was like, "Yeah, I do." I think my favorites are, my regenerative injection therapies. So using prolotherapy or a dextrose or sugar solution that actually causes inflammation in a joint or a ligament to actually cause inflammation, which then triggers that healing response. I use people's own blood and platelets. So using their own blood and then separating the red blood cells from the rest of the plasma, and with growth factor stem cells, white blood cells, and re-injecting that into a patient to help stimulate that healing process. I use some other injections that, aren't as common, like ozone therapy, which is a gas. And I'm using that for if there's an infection, or I need to actually gap a joint and actually give it some space. I put it in the blood to actually oxygenate the blood more effectively. It helps kill viruses, parasites, fungi, infections. So that's kind of a fun one that not as many people use. But I use it for a lot of different things, everything from a sinus infection, an ear infection, putting it into a joint to help, or putting it into the blood to help somebody heal, again, on a different layer than all the other things that we're doing for healing. I've used hyperbaric oxygen chambers to kind of stimulate and push oxygen into people's cells. What else have I used? There's many different. There's always a tool, and one of the great ones that I have now is using an ultrasound, so that I can actually diagnostically have an ultrasound, see where my needle's going to get it into very precise locations in a joint or, an area of the person's body to help them heal.
Did school prepare you for real life, or is it so much different once you start dealing with a real person? And how long did it take for you to truly start feeling in yourself with a real live patient?
Yeah. You know what? I think still to this day, it keeps me humble of, yes, I feel like I've seen thousands of patients now, and, there's certain things that are common, but every patient is different and everybody's going to react a little bit differently. So you can't just say, "Oh, I've seen this before, I know how to do it," because that'll humble you really quick. And somebody will not respond how you think they're going to respond. School definitely prepares you with education and the textbook side of it, but it's, and I was not the top of my class in school, in regard to test scores and that kind of thing. But I think I pride myself on being an amazing physician and giving 110% to my patients in office. And if I don't know something, I'm not afraid to say I don't know it, but I'm going to go figure it out. And I will also be honest with a patient, be like, theoretically, this should work. Are you willing to, give this a try with me? And let's see what happens. And, and there's times that patients are like, you were right on the money for what we needed to do. And then there's other times it takes a little bit of troubleshooting. But I absolutely love being in practice and seeing patients. And there's a new challenge every day, even if it's the same injury and you've seen this patient 5 times before, right? They come in and it's slightly better or something else is out, and you get to troubleshoot and work through that with the patient. And that's what I absolutely love. And I think it really shows how much I love my practice, and patients are like, you have a lot of fun in here. We're always laughing, and you got to have a sense of humor if there's a needle in your hand all the time, or else you're not going to have many friends. But patients know, they're like, it's not fun coming to see you, but I also know I get better. So it's worth it.
Was there any kind of training that didn't exist when you started going through school, but you're starting to see it coming now? And has it changed medicine in some remarkable ways?
There's always new therapies, I'm sure there's a lot more than I can think of right now, but like in school, we did learn some injection therapies, but we weren't, because not all of our supervisors had those certifications in their toolbox, right? So a lot of my regenerative injections I learned after school. Yes, they existed while I was in school, but we didn't learn them there. And then even ozone therapy, it's not as common, right? With a lot of practitioners, but I've searched out these things that I feel that really add to my practice. And I've just, I'm always learning. I love learning. And there's always something else that, even if it's a therapy I know, hearing it taught by a different doctor, or going to a conference and hearing how other people are using that therapy really then just continues to add to my toolbox of how I use that therapy. There's certain things that are used very commonly in there's something called mistletoe therapy. And for the longest time, I just thought it was used in cancer care, but I've recently kind of learned its benefits actually in pain management and inflammation, just with injuries too. So I should look into that a little bit more. And, I was at a conference when I was like, it can be used for other things, and it totally made sense. I just didn't think about it. And then, so ozone has become something that we didn't learn about in school, but I've kind of brought in after the use of different injection therapies, or just how they're used. That continues to change, and I continue to learn.
Where do you see naturopathic medicine going in the next 5 and then 15 years?
Yeah, well, I hope it continues to grow, and we're just in the middle of some amalgamation. So our college is merging with other complementary health professions. And so that will be a change. I'm really hoping to continue to grow the naturopathic scope. And just, one thing I would love is, so in BC right now, we can run labs, right, for patients and stuff, but we can't do imaging yet. And selfishly in my own practice, imaging would be very helpful to send a patient for. But that's where I have my really close relationships with other, medical practitioners that can, get that imaging for me. Or if patients already have that imaging, I would love to see that. I do have an ultrasound, so I can kind of, piece together some of the things. And but I use my hands a lot for kind of also palpating, feeling through the patient, where their injury is, how they're able to move to be able to get that. So in the next 5 years, I just hope naturopathic medicine continues to grow and people understand, the the amazing benefits that we can provide in healthcare, especially in primary care. BC has one of the largest scopes of practice, and so I hope that continues to grow. I mean, there's some states in the US that, we have hospital rights as naturopathic physicians. And I think that's an excellent way to kind of integrate health as a whole to really give patients the best possible care.
What advice would you give to anybody who wants to join the medical profession?
If you're passionate about it, do it. But it does, and one of the things, I always knew I wanted to go into it, and I made sure it happened, but it is a lot of school. It is well worth it now that I'm done. I love my job, and, it's interesting talking to people that, they like their job and they're like, yeah, I go and it's fine. But I don't think I could work 6 days a week if I didn't absolutely love it. And I have a lot of fun, doing what I do and helping patients get better. If you're serious about the medical field, go after it, apply. It doesn't always happen the first round, right? And sometimes that's a good thing. It helps you kind of reassess and reset and make sure that you're also prepared to go on a 10-year journey of, living on a mattress on the floor and having a bookshelf of milk cartons and not earning an income and actually paying to do what you want to do. But for me, it was the exact choice I needed to make, and I absolutely love my decision. But you get to see a lot of cool things, and you get to see a lot of things that you're like, oh, not everybody gets to see these things. So, but for me, I love my job.
Can you tell me about your volunteer work in Nicaragua?
Yeah. So after first year of medical school, we had the opportunity, and a bunch of my classmates at that time took that opportunity. And we went down to Nicaragua and helped in a nonprofit clinic on the island of Ometepe. And so there was actually 20 of us that went down, and we split up into groups, and there was a licensed naturopathic doctor working with us. And we saw patients that were from, that had no money to actually get the health care, but we were offering this care as a student clinic. And it was everything from somebody coming in with a bladder infection to somebody actually having a broken foot that they had an x-ray, but, had sat all day in the burning hot sun to see us as a doctor to get supplements, or to, help with their diabetes and to work on blood sugar control, or somebody had an ear infection, somebody needed a pelvic exam, right? Somebody needed a pregnancy test, right? All these things that they don't usually have access to, depending on where they lived in Nicaragua. And then they were able to come see us. And so we did, I think we were there 4 or 5 days working in the clinic. And then a bunch of us stayed in Nicaragua longer and toured around. But it was so rewarding to be able to actually see these people that are, and I probably say it was one of my favorite places to travel. These patients literally have nothing, right? Very little, they're working 12 hours, in a coffee field or, other kind of plantation. But they were just so it really gave me a new aspect, appreciation for life. And, they had really nothing except, their mud roofs on houses, and they were so happy. And it just gave such a different outlook than we see here, where we have more income than they do in Nicaragua. And, but I loved the people. They were so happy. I climbed volcanoes. I helped patients, naturopathically. We were even just doing physical exams, listening to their heart, listening to their lungs, right? Doing palpation of the abdomen. And So it really got our clinical skills up, as well as being able to like help these patients and get some care that they wouldn't have otherwise got to get.
That is amazing. And would you say that's one of like did you get a better appreciation how you live in a Western nation, Canada, as opposed like seeing people who, that's it. Like they work brutal long hours for barely anything. And they're going home to something that's probably leading to their health being problems too, with bad roof, everything like that, whatever, and just the bugs and insects. How quickly did your eyes open to seeing the other side of living?
Yeah, and it was very eye-opening, but I absolutely loved it. And it made me like so happy to volunteer. And, I had 1 year of medical school under my belt at that point, like, so we were working in groups, and like there was like 4 of us and a doctor. And so we were all also learning from each other, or we had a bunch of supplies that were donated that were shipped down. And so, something that I may have prescribed here in Canada, we may not have had, it wasn't donated, or, everybody needed it and we didn't have it in the clinic, but other ways to like, what else could we kind of pull together to help these patients? And they were just so grateful. I loved it. And then just traveling around and just seeing how they live. My friend and I, we stayed in like every local hostel we could, and we rode their chicken buses. So there was like animals. It was like their public transport. And then, there was like a pig on the bus, and there was a chicken in a cage on the bus, and and you're going down a dirt road. And I was like, man, this is, I'm fortunate to have these opportunities of like going to medical school here in Canada. But I also loved, helping patients that wouldn't actually get that care. And they were so happy to have it, even just it's also about that like connection and like physical touch with a patient, like as soon as you're able to put your hands on a patient to help them, whether it be they're saying something in a completely different language or pointing at where it was sore, as soon as you are able to put your hands on it, there's that human connection and that transfer. And there was so much less hustle and bustle than there is in our world, where no one, like everyone in Nicaragua acknowledges everybody as you pass them. And I loved it. And then I come back here and I was like, no one says hi. So it was so different. I think it was such a great opportunity, and getting to see a different part of the world, and it wasn't a touristy place. Like we were in like a small island, right? It was a volcano island. So
if you were to be able to have the free time to do that now with the knowledge you have, what would be the next country that you would love to help?
Good question. You know what? I would go back to, Central America, South America. I would, there's like Doctors Without Borders, and there's the NDI, or Naturopathic Doctors International. I would definitely, I don't see why not. I could easily go and do something like that again. And there's a lot of injured people out there and that you can help. And it would be fun. I should actually look into that.
Well, that'd be awesome if you do go.
It's another way to travel too. I don't even know where I'd want to go. I'd have to like look and pick a place on a map.
Well, you'd have to give us regular show updates on if you do travel like that. Can you talk about some of the treatments that you offer and kind of the average person, and maybe some of the nutrient deficiencies that you see in a general population, and some of the more common injuries and things like that, that again, the general population seems to be suffering from more and more?
Yeah. One of the biggest things I see is underlying inflammation, right? Inflammation is and pain, right? So pain is that signal that our body is trying to give us that there's something not working. I kind of explain inflammation like a fire in the body, right? What puts out fire? Water, right? So the body is holding more water. It's showing that there's pain. There's there's a fire, there's something going on that needs to be addressed. And that inflammation can come out as like an injury, right? You sprain your ankle, there's inflammation, it swells. It also comes out as if there's inflammation in your vessels, right? Then the body is having to try and patch those up. You're getting more cholesterol patching up those holes in those vessels, right? Then you see somebody with higher cholesterol, or you're seeing inflammation in the gut and they're not absorbing foods and there's food sensitivities, right? If there's inflammation in the gut, there's inflammation in the brain. They're very much connected, right? If somebody has a concussion, that's sure that there's inflammation in the brain, but then we're looking at like, is there mental health? Is there anxiety? Is there depression? These are all symptoms of inflammation in one way or another of the body, making it clear that something's not right. A lot of so gut inflammation, food sensitivities, working on digestion, working on the absorption of nutrients, right? If you can put all the healthy things into your gut, but if it's inflamed and it's not actually absorbing it, you're not getting those nutrients, right? The stomach is taking everything it needs to, or like your intestines and your whole digestive tract is taking all those nutrients you're eating to try and heal itself, and your other cells aren't getting that necessary nutrients to get better, right? If you see an injury that's not healing in that time that it's supposed to heal, it doesn't always mean that you have to take more painkillers, right? And mask that problem, right? It helps, right, in one way, but at some point you have to say, what's the underlying cause of why this isn't getting better and what do we have to do to fix it? So in my practice, I do a lot of orthopedic pain and injury management. I'm seeing acute injuries, subacute, and chronic. I do a lot of regenerative injection therapies to help actually regenerate joints, ligaments, tendons, muscle to help in that healing process. I do use cortisone very rarely, but there is a spot for it, right? There is a spot for medication for people, right? If they're in so much pain that they can't go do those other activities of like daily living, like get out and go for a walk, or they're in so much pain that they can't even go grocery shopping and cook for themselves, we can't expect them to get better if they're not getting those nutrients because they can't even get out of bed. So medication sometimes can get us over that hump in order to then work on those other things that help in their body healing. So, I'm not afraid to prescribe if I need to, but I do try and take that more natural approach. Is there a supplement we could give them? Is there a nutrient? Can we do like IV vitamin and nutrient therapy, getting those vitamins right into the vein so that those cells get first priority over those nutrients while their gut is healing, right? If we can bypass the digestive system, get those nutrients into the cell, then those cells have that little extra power and oomph to help in that healing process while the digestive system's healing. I do a lot of health optimization. So you don't only have to be sick to come into my clinic, right? There's people that come in and they're like, I'm actually doing quite well, but I have a history of, inflammation, or I have a history of high blood pressure, or, there's a family history of a certain medical condition. I want to try and prevent that. What can I do to continue to take care of my health so that I don't go down that same path? I do a lot of digestive health. As I said, I do IV vitamin and nutrient therapy. I do a lot of immune support. So even just during cold and flu season, right? Like we all get colds and flus, but how do we actually support the system to be able to fight those and continue to, you don't get like that cold that everyone lasts, 3 or 4 days and you're out for, a month or two just because your body doesn't have those resources to heal. Those are my great things to do. Those are fun things to do. I do some aesthetic injections. So for like Botox, I also use it for like medical purposes, for migraines, for, if there's a lot of tension. There are other injections that I prefer to use over that. But if it's a last resort and we can't figure out how to fix their migraines, they've tried medications, they may have tried some of the other injection therapies I do to decrease inflammation around nerves or to loosen those muscles, then we may have to go to a Botox. But I do hold that certification. I do a lot of ozone therapy. what else do I do? I have my list here just in case I forgot. But yeah, so I see a lot of, things, in regard to the regenerative injections, working on whiplash after a car accident, right? So whiplash is one of those things that, you hear somebody had a car accident years ago and they still are struggling with neck pain, right? It doesn't mean the body hasn't healed it, but it also is that those muscles have remained tight to protect an injury like that from ever happening again, right? Those muscles are like the older brother or, that older sibling that will always protect their younger sibling, or the more delicate, fragile structures like, ligaments and the spinal cord. I treat a lot of joint injuries, so shoulders, elbows, wrists, knees, ankles, hips. I do spinal injections, so like helping ligaments through the spine. I can pretty much inject head to toe. Knees, hips, ankles, ligaments. I do a lot of arthritis, and if there's like joint degeneration, there's injections that we can do for that. But again, it's everybody. It's not one size, one treatment fits all. So I'm working with those patients also, what's in their budget, how long have they had this? How is it affecting their life, right? You can have somebody with a bulged disc that has no pain, and you can have somebody with what looks like on imaging, a very little bulge disc, and they are debilitated, So you got to meet the patient where they're at, both with imaging and then also how their symptoms are affecting their daily life. I help with like dislocations, tendonitis, joint pain. I do a lot of TMJ. I do a lot of jaw injections. I actually worked with a biological dentist for a while. He taught me a lot of different things about dentistry. And then I was able he would fix, the jaw and the bite. But if that jaw isn't set right, everything else in the body also has to shift. And so then I was doing all the injections to kind of help stabilize everything else once their jaw was actually in alignment. In regard to aesthetic injections, so that's kind of my regenerative injections. For the aesthetics, yes, I talked about Botox. I also do stuff for hair loss, actually trying to regenerate that hair follicle to start producing hair again. And that's using your body's own blood and platelets to actually stimulate new hair follicle growth. Of course, fine lines and wrinkles, building collagen, right? Making sure that the skin is healthy. And we do that we can do it with injections. We can also do it with diet. Maybe there's some different face treatments we can do. Acne, skin rejuvenation, skin toning. I treat a lot of nerve pain as well. So going back to those regenerative injections, so like nerve pain, neuralgia, surgical scars. When there's you can kind of use my blazer as it. So if there's a hole or a surgical scar, right, in order to actually heal that up, it's like having a hole in your shirt. But that surgical scar bunches everything up. And all the layers between the outside where it was surgically cut and that inner layer that you have to heal all gets bunched up together. And so when you bunch it all up like this, all of those layers are together. Nerves get caught in it. You're not getting that flow of each different layer of tissue moving on its own. So I'll actually go in with a needle and actually kind of work all those layers away from that surgical. It's almost like it's all pinched together, and get each layer moving individually, which allows nerves to regenerate. It allows more movement, right? Like if I do this, even the bottom of my shirt is going to move, even though I'm actually up here. And the same kind of thing happens with a scar. So I'm actually helping to kind of release that scar, and whether it be after a surgical scar or like a bad accident. C-section scars are a big one. And because all of those layers have to be, sewn together to fix that wound. And then I actually go in and help, and it really helps, patients be able to move better because it's not like there's like a stake here that's preventing that fascial movement. I treat a lot of headaches and migraines with something called neural therapy. So we're actually trying to decrease inflammation around those nerves that are actually kind of triggering that headache. I do a lot of trigger point injections to release muscles, get them from being tight and fired like this. We get them to fully contract where they actually have to release. And that really helps to kind of reset how that muscle is communicating with the rest of the body. So I do a lot of trigger point injections. And then, of course, like with pain management, like sports injuries, sports optimization, I do acupuncture trigger points to help release those muscles. I do cupping, I do adjustments. Again, cortisone injections, hyaluronic acid injections, which is actually like a gel solution into the joint to actually give that buffer. If it's bone on bone, right, where there should actually be synovial fluid or like a fluid in there, we can actually put an artificial fluid in there that allows that joint to move better without, being right bone on bone with each other, and which again causes pain, right? And then, of course, I do lab testing. So like food sensitivity testing. I can run all different like Life Labs tests to run any kind of blood work that the patient needs. Of course, people pay privately for that, but we are able to run more testing than, say, other practitioners can run, but you pay privately for those tests. I do treat some women's health, like physical exams, breast exams, pelvic exams. Of course, I do physical exams. So if any heart, lungs, abdomen need to be listened to. Again, I'm helping with mood support, mental health. I still contract out and do some work with addiction, which I have a very soft spot in my heart for kind of helping people with that. I do a lot of the injection therapies as people are coming off, whether it be a prescription drug or a recreational drug, and those ones that are trying to just reset their cells to get into a better, more youthful form of that cell than it was when they were struggling with addiction. And I mean, that's that's not an easy one. It's not a black and white of you get an IV and everything's better. But, my undergrad's in psychology. And so I have this like love for helping people that want to get better in whatever aspect that is, At my New West clinic, I do a lot of like weight management and weight loss support. So that, between my Chilliwack clinic, where I do a lot of pain management, in New West, I do a lot of weight loss, but I still see pain as well, right? Because when people, they have that pain, they need to lose weight. So I'm helping lose that weight. And then I'm also helping to fix those injuries that have, kind of been a burden for them for quite a while. I help with sleep support, right? If you're not sleeping, you're not healing what needs to be healed, right? You're not giving your body that break. And then, of course, I do hold my prescription license to write a prescription when needed. But I do try and do it as naturally as I can. And that's about it. I'm sure there's more, but that's...
No, that's awesome. Can you make sure to give everyone your information and stuff like that so they can find you after the interview?
Yeah. So I do have a website. It is www.drheathernd.com. And doctor is actually spelled out. So DOCTOR and then Heather, HEATHER, ND for naturopathicdoctor.com. Again, all of the handles I'm giving you are doctor spelled out, but my Instagram is at Dr. Heather ND. And that's also my Facebook business page as well. So DOCTOR Heather ND for Facebook, Instagram. I do have a YouTube channel. Haven't really posted on that much, but it does talk about some injection therapies that I do. The hair injections are on there as well. And then, and my website has all the information about all the different services I offer and where my clinics are.
Awesome. Thank you so much for doing this. It's going to be really valuable and stuff like that, especially when I go back over and start hearing some of these treatments and look into them, stuff like that. Because, I got goals and I don't want to let the injuries keep them down. Yeah. So thank you so much for giving me knowledge and for the audience.
Thank you so much for having me. And if anybody ever has questions, I'm always happy to answer them. Or we can set up, a 15-minute, what I call a meet and greet, to just kind of answer about these therapies, because sometimes before you go and invest in that therapy or to see if it's right for you, it's good to just get a little bit more information. My website definitely talks about it, but I'm able to kind of give a little bit more just information over the phone as well.
Perfect. Awesome. Thank you so much. And thanks for your time. Please like, subscribe, and comment to help grow the show. And remember, get back up.